want our pregnant moms to be doing all of the same things that we're recommending for the rest of the population, staying at home, practicing, social distancing, limiting the number of people they come into contact with, and limiting the amount of time that they're spending outside of their home. Each clinic in the Asheville area is performing their visits in different ways. There are often some telehealth options as well as phone calls, checking in with blood pressures or blood sugars, as well as simplified ultrasound screenings. And these are things that you should call your specific physician about. So we also know that during pregnancy, 24 hours a day, a mom can wake up and think that something just doesn't feel right. And we want to encourage moms to call at any hour of the day if they're really concerned that something's not right with their pregnancy. In addition, if they're feeling short of breath, having a fever, a cough, especially in these times, it's really important for them to call. We are still always available 24/7 for any OB emergency that they feel they're having. We are very well staffed and ready if a woman is worried she's in preterm labor, if she feels like her baby isn't moving, if she's having bleeding or any other concern that she feels she needs immediate hospital care, we are here for her. We haven't found any of the virus in breast milk. So for our moms who are going to be postpartum in the next coming months, we want to reassure them that they can breastfeed as long as they're taking precautions in terms of washing their hands and limiting the amount of respiratory droplets they may have with their infant. We know that breast milk is the ideal nutrition for babies, and so we don't want anyone to hesitate breastfeeding in the postpartum period in this setting. Do your absolute best to lean on the people who you know are in your life to support you, whether that's in person or via the multiple technologies we have to connect with those people. We've had a fair number of women who already have experienced anxiety either in or outside of pregnancy, as well as depression, and those things are very real, and we want to support our moms who are experiencing worsening anxiety or depression. Making sure that you are noticing those feelings in yourself and reaching out to your physician, a friend, your strongest support person, and letting them know you're experiencing those things. When I think about a pregnant mom in this time and her postpartum experience, I would say that time with her baby is of the utmost importance, and that if the mother is not confirmed positive, then spending time with her baby in the normal way that she would postpartum, skin to skin, staying at home, breastfeeding, washing her hands, those are all things that I would encourage, and I would reassure mothers that that is still the very best thing that they can do for their babies at this time. And what a great excuse to say, I'm sorry, I have to stay at home for 6 whole weeks with my baby, and to try to really enjoy that time at home as a new family with a new family member, and try and be as calm and bubble yourself off as much as possible during these scary times.